Welcome to a special series of This Week in Canton City Schools, where we will focus on the mental health and wellness of our kids and families. I'm Robin Matalich, your host today. The Canton City School District continues to partner with the Child and Adolescent Behavioral Health Agency. This agency provides a myriad of resources to the Stark County community and, most importantly, to our students within CCSD. Each month, we will feature resources and strategies to help the mental well-being of our young people. Today, we are speaking with C&A's Marissa Cooney, Prevention Supervisor, and Heidi Wilson, the YMCA's Vice President of Child Care and Camping. Welcome to the program. And let's start by learning a little bit about each of you. Heidi, please tell us where you're from, where you grew up, college, and how your career path led you to your role at the YMCA.
Sure. I grew up resident of Summit County, actually, not Stark, but moved here very early in my career, and knew very young that I wanted to go into something that affected youth. Originally went in to be a teacher, and as many of my staff at the Y did, got into a traditional classroom and just didn't feel like it was the right fit for me. So had been working with the Y for my entire time through college at Kent State University, and graduated with a degree in secondary education, government, integrated social studies, and said, oh no, I don't think this is what I want to do, and what am I going to do now? And so we actually, I have worked with the Y since 2007, and throughout that time in my career, after I graduated, I said, okay, I think this is where I want to be full time. And so 10 positions later, I am sitting
Well, the Y
in
is very lucky to have you.
Oh, thank you.
Okay, and Marissa, we want to welcome you back to the program, and why don't you refresh our viewers with your background?
Yeah, so I am Stark County born and raised. And so, yes, so I've stuck with Stark County. It is where my passion lies. And I am a licensed social worker and prevention specialist in the state of Ohio, specifically serving Stark County through child and adolescent. I've been at C&A since I graduated. I did my internships at C&A, so I kind of just stuck.
Wow.
And also several positions later, now being the Behavioral Health Prevention Supervisor, and I've been there since 2019.
Wow, impressive. So can you tell us, Marissa, how long has C&A's prevention staff been working with the YMCA after-school programming?
Yeah, so our collaboration with the Y, I think in 2025, we're going into year 5. We started in 3 different sites one summer, and then from there we have just kind of flourished and boomed into almost all of the Stark County sites at this point. So yeah, I think we're going into year 5.
Very nice. And Heidi, can you explain to our viewers how this partnership was formed and which YMCA locations does C&A serve?
Absolutely. So very early in our conversations, it was actually Joe, the previous CEO, and I were having some conversations about summer camp and the needs of our kids in summer camp. And as Marissa mentioned, we started with that because all of the one-on-one intervention that they get in schools and with our public education goes away in the summer. And so they come
summer
to
slide.
us. Yeah,
we get that too with math and reading.
Absolutely, and it
summer
happens.
School is very important, but kids don't want to be in school all summer.
And it happens with mental health. So as we provided, Monday through Friday, 12-hour-a-day care for these kiddos who needed some additional assistance, my staff aren't qualified for that. And so we went out looking for some assistance and some partnership with a agency in the community that does that so well, and we found C&A. And so today we have C&A prevention staff and therapists who are accessible to all of our summer day camp locations, which is 7 across the county. We serve about 800 students in that a day. And then over the school year, in all 27 of our locations, for a certain amount of hours per week, depending on need. So
Right. That's fantastic. Yeah. Always great to have wonderful partnerships. Marissa, how does your team support the staff and students in the after-school program?
Yeah, so our overall focus is mental health and wellness, specific to social emotional growth and development. So a lot of our focus is on just helping staff feel comfortable, feel confident, surrounding the students with any kinds of mental health and social emotional supports. So a lot of that is just having open, honest conversations about what is working, what are maybe the areas for growth, and how we can help get them there and help them be like the most successful versions of Y Care that they can be.
Okay, and just moving that along, what type of skills and strategies is your team working on with YMCA staff?
Yeah, so a lot of what we do focuses on boosting the self-esteem of the students. That is huge anymore. So just making sure that it's an overall positive but accountable environment for staff and students. This year we've moved more towards an action plan territory, which is awesome. So each site has their own individualized wants and needs as far as that mental health service goes. And so our providers are going in there and having conversations directly with the staff who are in those positions, serving those students, serving those families.
Right, so everybody gets what they need.
Absolutely,
Right,
yes.
tailored
It's not a
plans.
one-size-fits-all.
Right, so it could be different at every location.
Correct.
Wow, that's incredible. So Heidi, how has the staff received and then implemented what the C&A team has provided consultation on?
Absolutely. So our staff are extremely excited to have this partnership. There are so many things they're trained on as they come in to work with youth, and people come from all different backgrounds to come and work with our youth. And so they really have been excited. I think it's been an amazing transition of our partnership from just coming in and saying, hey, how can we help, to now being so strategic about what that group needs and working with the staff together to have those conversations. And so they are really, our focus has always been character education. As a Y, that's been our focus, but now that needs to morph into what those skills look like on a hard skill level, and that's where C&A comes in. So our staff have really taken those hard skill pieces as opposed to just that really positive interaction and relationship, adult relationship that we pushed, and now they have those skills to actually implement.
Right, and tools to use to help them as well.
Exactly.
And Heidi, what has the Y noticed regarding how the staff is interacting with the kids now from when the partnership was formed?
Yeah, again, I think it's about being intentional. So they're saying they knew that they needed to have and always have had that positive interaction. They want to be there for those kids, know that the kids know that they're there for them, but now they have those specific skills and intention on saying, hey, this is what this group of kids needs, or this particular child needs this for me, and now I know how to address that in particular. And so that's really been a game changer for us.
Wonderful. So, Marissa, can you tell us what skills your team is working on with the youth who are coming to the after-school sessions?
Yeah, so as far as the youth go, a lot of what we're trying to do is trust. Trust and relationship and rapport is huge for these kids. They're at school.
What are the ages?
So they are typically school age, so anywhere from kindergarten 5-ish all the way up to 11, 12-ish.
Oh, okay.
Yeah, and then summer it expands a little bit.
Through middle school.
Through middle school, got it. Okay. And then, Marissa, will you talk about with us the successes that you and the Y have had together with this program?
Absolutely. I think we've had a ton of successes. Most notably, I think we've, again, really helped staff feel more confident and comfortable in their skills and their abilities, but also in maybe what they're not comfortable with and what they need to pull someone else in for, which is exactly why we're here. They have expertise on the students, on the children, on the needs of the families, and we come in with the expertise of, here are some strategies, let's work together to figure out what some of the solutions are. So I think that teamwork has been a huge success for this partnership.
Sure, I can agree with that. And Heidi, from a YMCA perspective, what is your staff seeing as far as temperament with the youth?
So we're just having, and I think this is adults and kids, truthfully, as we work with the community and as a whole, it's hard to regulate emotion. These days.
Oh, sure. Anybody's these days.
Yeah, there's so much going on. Everything feels like a lot and heavy and challenging. And so being able to kind of compartmentalize that, and as you have challenges arise in your life, how do you deal with that? How do you deal with that in a healthy way, as well as being able to move forward effectively? And so we're seeing that in our youth. We're seeing that in the adults that we, that we interact with, and we're also just seeing, challenges with some additional behavior pieces that are diagnosable. It's more than maybe it used to be, and which is great. We're seeing people actually address challenges with their kiddos. That's a great thing. So we're seeing those diagnoses a little earlier, and we're learning those specific skills that pertain to those diagnoses. So
okay, so when you come to a diagnosis, do you meet with then the families and discuss a plan with them? Is that
We
how
do.
this works? So that, like you said, the things that you're implementing go into the home?
Yes, so we always ask families ahead of time as they register, what's going on? Is there something additional needs that your child has? That can either be from, the school year, if they have something going on in the school that is formal, we like to have that information, obviously, to be able to meet that need. But we'll sit down and say, okay, what's working for you at home? What's working for you in a classroom? How can we, and that's where, C&A and our school partnerships come in too, because we can talk to the teachers and say, hey, what's going on in the classroom that we could take to the after school? It doesn't change from 3:05 to 3:25.
It does not change. It probably gets worse.
Exactly, right. It's a bigger group of students.
Right.
It's much more going on.
Right.
And
different things going on.
Exactly. So we try our best to really get individualized with those families and those kiddos with diagnoses.
Got you. So do the youth look forward to C&A staff coming in each day or certain days?
I think they really do, yeah. As with all of our staff, and this was why the partnership was so critical, and that we have the same goals. Like our partnership is just natural because we have the same goals, and so one of those, obviously, as Marissa said, is relationship. Our kids need stable adult interaction that is positive.
Everybody needs that.
Everybody needs that. Yes, exactly. And so, yeah, me too. So our staff and our kids, I think, really look forward to just, hey, how's your day today? Yep. What was the high-low points? How can we talk through it? Parents don't always have time and don't know to have what words to use or those types of things. And so, it makes a big difference.
And I would guess if a child is having an issue, they might seek out that individual.
Absolutely.
Without that individual coming and finding out, hey, what's going on? Maybe they bring it to them since they have access to
Absolutely.
these
They do.
folks
And it's
at your organization.
easier to talk to, one of the C&A staff or a Y staff than it is your mom and dad sometimes.
A lot of times you don't want to share that information with your parents.
Exactly.
But I get that. That's incredible. Marissa, can you describe what a typical day may look like for your staff going to Canton City elementary school locations?
Yeah, so most of our staff arrive at the end of the school day, kind of walk into the school, check in with any secretaries, all that good stuff. So we do try to maintain that positive partnership with the schools that we're walking into, as well as we are guests in there. And so then we find our way to YCare, where we typically just check in with the staff, check in with any kiddos, usually greet the kiddos, do some activities with them. A lot of it, again, is just that communication piece, that relationship building piece. So asking how their day is going, both for staff and for students, and being very prepared for an honest response. And so then a lot of what we do is if there's a specific need that arises or that's brought up, we absolutely will work on whatever that need is that day. So if, kiddos are struggling to self-regulate, or if kiddos are struggling with peer-to-peer relationships, that's always a pretty standard
Especially
need
at those ages.
at after school, for sure. So a lot of times we just try to see kind of what's going on, how we can be of help, and how we can maintain empowerment among the staff and the students. So making sure that we're not swooping in, but making sure that we are there alongside them and supporting them. Talking to families is a part of our day. So if there's any communication that needs to happen as far as any ongoing concerns or really amazing things that are going on, we always try to communicate that with staff and the parents somehow during drop-off and pick-up and all of that good stuff. So
Okay, and I just want to clarify, and either one of you can clarify this for our viewers. When I say going into the elementaries, you're going into the YCare after-school program. It's not C&A it's C&A through the YCare.
Correct.
Okay.
Correct. Yep.
Yes.
We are with YCare students.
Right. Okay. I just wanted to clarify that.
Absolutely.
Somebody might have a question.
Yeah.
For that. Okay. And Heidi, where do you see this partnership going as you move forward?
So we're so excited about the fact that we have such a broad scope of locations served at this point. We certainly know that looking at all of the data that we've collected, as well as just anecdotal with our staff, that it's made a huge impact impact. So I think our goal, as we sat down, just this year to look at what do we do to kind of integrate this partnership even further, it is about being really super specific to each location and what are the needs there? How do we continue to move that forward? And how do we continue to be preventative in our mechanism? So not just reactive to what's going on in the space, but how do we start putting in programming more that is preventative and teaches skills to the entire group, not just individuals who are struggling. So that is definitely a portion of that. And I think we're also, constantly assessing what does it look like in the summers as well, because that is a super high need time for us. Yeah. And what does it look like to really effectively serve those groups? So.
Got you. And Marissa, I'm sure there's a cost to this program. Can you describe for our viewers how this program is funded?
Yeah, so it's funded in various ways because it is a significant cost. So for Canton City specifically, a lot of the funding comes from Sisters of Charity and United Way. So any donations to those two are greatly appreciated because it helps us to be able to.
At least now people know where the money might be going to.
Absolutely.
Okay.
Yeah, it absolutely goes
for sure.
directly into our programs.
Wonderful.
So that we can continue that mental health preventive lens, but also making those connections and those referrals to any ongoing services that might be needed.
So there's no money out of a family's pocket for these services?
Absolutely not. No family has ever
had to pay
received
for any
cost
service.
for.
The Y is also, we're committed to this program, and so we were fortunate enough to have some funding that came through the federal government, as nice. All agencies did.
Love that government.
Right, that was nice. We're no longer there, so that funding has stopped, and so as a Y, we're really committed to continuing this programming and placing it in our budget. So that, of course, comes with asks from us to the community and agencies and financial places that we typically ask, and they've been really supportive so far. So,
Heidi, as a community, we are moving further away from COVID, yet as I hear from educators' colleagues, the younger children are still struggling with some of those socialization skills. Is your staff seeing this at the Y as well?
Absolutely. I know Marissa mentioned that interpersonal piece and peer-to-peer. That's tough. It's not just tough for our youngest. I mean, we struggle with that with young staff and not being able to pick up the phone and call someone as opposed to
texting them.
Yes. So technology has definitely played a part in that. I think we will see COVID challenges for many years, as the data says, but we can't disregard all the other things that are going on in our society, and so technology is a huge component of that. Absolutely. And we're seeing it just as schools and everyone else are seeing those same kiddos.
Yeah, I never thought about the younger staff coming in that are completely relying on devices or technology to get them through the day. I never thought about having to have that one-on-one interactive social skill. That's tough. That scares me for the future.
It's tough. They're working on it. We're working on it.
Absolutely. Yeah,
we're going to solve that. Heidi, can you tell us, if the YMCA did not have resources like C&A, how much harder would it be for your staff to navigate these challenges year-round?
Absolutely. Summers, I can tell you from experience, especially summers, but unfortunately, we wouldn't be able to serve half of the kiddos that we're serving. And that's not, our mission is to have everyone in programming. That is what we do as a Y. We find a way for families to get into our programming that need it. And it's about the fact that we couldn't run groups effectively. We couldn't keep kids safe from themselves or from others if we didn't have these skill building and prevention pieces. We know that reacting to behaviors is not where we want to be. We want to be able to prevent them ahead of time, and that sounds lovely, and we're working on all of that, right? But
that's what everybody's working on all over from day to day in every environment. I think in every organization, it's being preventative nowadays, which is a sad thing. But at least we have organizations like C&A to help us through that. And I'm sorry if I cut you off.
No, you're
good. Wanted to have anything else further to say about the how much harder it would be to navigate.
Yeah, unfortunately, I think we would just have to have a lot of, students who do have those higher needs would be difficult to serve in our environment. The way that our programs are set up aren't set up in tiny small groups, and that's just the way that we operate. So without this additional assistance, we would really struggle to serve those kiddos who need it the most.
Got you. And Marissa, your prevention team works with kids of all ages. C&A has an early childhood prevention team, and your team works with adolescents. Do you see this partnership continuing into the future to meet the ever-changing needs of each community served?
Absolutely.
Yes.
Kind of just like you two had just covered. My passion is preventing, is prevention. I very much like to go in and see how we can not only serve kiddos ongoing through clinical services, but also how we can come in and empower those students again, and those families and those staff supports. And honestly, as much as we like to try to work ourselves out of a job, because that would mean that there's no more struggle.
Right. Well, that's
correct. We know there is job security.
Right.
And so I absolutely see a partnership such as this continuing, because everyone could always use supports, even in the most healthy of communities. You need to maintain those supports to maintain that health. So.
Right, so I think I could guess the answer to the next question for Heidi. Is this a model of preventative care that can be modeled around the country at other Y locations?
Funny you mentioned that. So we have a statewide. I work on a lot of state coalitions, and we actually have a statewide child care summit for the Y every year. And myself and a friend of mine from Toledo actually presented on these, because we have two different models, but doing the same idea in our programming. One's an internal model, one's a partnership model. And they have the resources to be able to have an internal model where they're hiring people on, but we don't. And so as we had the conversation, it was about, this can be scaled to any Y, to any location. Obviously, it takes some doing to explain exactly what the good looks like, and to have the data to be able to show the community for financial support, because as a Y, that's one thing that's difficult for us, is to, to come up with that financial support. But this is a case for financial support that is easy to walk in a room and have a conversation about. So absolutely, I'm talking about it every chance I get, and making sure that my Y colleagues know what we're doing here in Stark County, because I think it's an amazing model, and it's been an absolute change in the way that we serve. So
that's incredible. Everything that both of you do is much needed in the community. And is there anything else either of you would like to add before we wrap this up?
We pretty much covered the partnership. Yeah.
Yep. Very, very excited. So.
Wonderful. Well, I would like to thank you for the information you provided our viewers today, and we look forward to sharing all the wonderful work ahead for C&A. For more information on this topic and so much more, you can visit the C&A website, www.childandadolescent.org, or you can call the C&A office at 330-433-6075. Thanks to Daniel Mucci, Mission Advancement Director, for helping to coordinate this episode and future episodes in this partnership. Please visit our website at ccstv11.com, where you can get information on all of our shows and watch us on your favorite device. We will see you next time, and remember, your health is your wealth.